Hey everybody, this is Jordan with the Crohn's Veteran Podcast. This is our first episode of the new year. Excited to be here with my amazing co-hosts Renika and CJ. How are you guys doing?
Doing excellent.
Good.
Happy 2021, everyone.
Thank you,
Hey,
thank you,
Renika.
and we are honored
Awesome
to
to see you.
right, and we are honored to have our first guest of the year and also our first repeat guest on on our show. Victoria Tomlinson is here joining us today. How you doing?
Um, yeah, well, I'm waiting to have surgery. I could, go more into that. I have like two more tests coming up, and then a visit with the surgeon to make a game plan for surgery. So finally getting somewhere. This has been a really hard journey trying to figure out what's going on inside of me.
Mm,
Yeah, for the doctors, even, they've been really perplexed. I'm having a gastrogaffin enema study, which I had to look up, and a CT enterography so that he can see like really good detail.
what is could you for the folks that are listening, would you mind explaining what the first one is about?
Yeah, so they'll be both times they'll be injecting a kind of a dye.
Mhm.
And well, the animal one, from what I understand, they'll be doing it through my ileostomy and the rectum, or just really get a connection of what's going on between there.
Okay.
Because I also found out at my surgeon's visit that I have a loop ileostomy and not an end ileostomy.
Okay.
So I had to look that up too. So an end ileostomy, a loop ileostomy does what it says. It kind of loops around, right?
Mm-hmm.
Well, evidently, they're kind of thinking there's a fistula in there that's causing problems. So that I'm actually having normal BMs and output from the ostomy.
Okay.
So I feel really awful, like super nauseated, like all the time. There's a lot of pressure, a lot of different pains, just a lot of stuff going on. My kidneys hurt really bad because I have a bladder infection that I've had back-to-back bladder infections going on like a couple of years or longer because nobody's been able to correlate this. And before, I think I was having them because of a fistula, which is why I had the ileostomy last October.
Mm.
But then I even left the hospital with a bladder infection last year when I got out from my ileostomy. So, and I still have one. So that's, my kidneys are hurting. It's anyway.
And then, I mean,
So
that's what people, so that's what, and again, that's what people don't realize, is that Crohn's is not just, in your digestive system, it can affect all different parts of your body and cause all kind of, related things. And so thank you for sharing, that story. And you're also mentioning, Victoria, that, just, your experience with, pain management, with Crohn's, so, yeah, so I mean, and also, and a lot of folks out there, there's a lot of different ways to kind of, feel better. Some people use, like doctor prescribed medicine. Some people are more holistic route. And so, if you'd mind, expanding a little bit more, on what's going on with you, in relation to pain management.
Sure. So after explaining all that to my new pain care specialist on Christmas Eve, he decided to lower my pain medicine. When I went in there, I told him this, and initially he said, "Oh, well, we're going to have to help you with one of those things then, and let's see if we can get you to feel better," and blah, 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 And then he saw that I would use cannabis, and he basically said, "You need to get off of that, and you need to get off of opioids, and it's just poison for your body." And he must have said the word poison half a dozen times at least just poison. He just, it was just like, whoa, guy, stop, you know? And you know, of course I was really frustrated, and I was like, you know, so, you know, it's the only thing that's allowing me. He really, that, I don't think that even registered in his thinking. I mean, because if I didn't have cannabis right now, I'd be in bed, and that would be it. I'd be in bed. Somebody would have taken care of me right now. You know, I was thinking today, I probably wouldn't even be getting up to go to the bathroom. Somebody would have to help me, you know, with my ostomy and such. And the only way that I'm doing this is by cannabis and the tiny bit of opioids that I was on, because I also have scoliosis too.
Mm-hmm.
Besides all this. And yeah, so we decided to lower it. So immediately I started lowering it myself because I know it's coming.
Right.
And, you know, so my next dose will be the lower dose that he prescribed. And so I've been, you know, I'm doing cannabis flower. It's holding me, I think, pretty well. I only do the most I can find is 30% THC in the flower, which really helps my nausea and just the whole, it just makes me function. And, you know, so.
Well, you can know, Victoria, that, you know, at least, you know, speaking for myself, you know, I'm a big proponent of cannabis too. You know, I believe that, you know, there's a lot of, you know, medicinal value in it, you know, that I know I don't believe it should be stigmatized. You know, I believe that people should, you know, can use it because they like it, or people, you know, can use it just because, you know, that addresses a certain medical issue with it.
Mm-hmm.
You know, I know that, you know, in places that I'm pretty confident that in places that it's, you know, legal, like Michigan and stuff like that, that it's on this, that's on the list of, you know, Crohn's, you know, is one of the specific conditions that, you know, that qualifies folks, you know, for medical cannabis and stuff like that. And so, you know, so
right.
so, you know, I'm all about
You're right.
I'm all about what
and digestion issues also.
Mm-hmm. Oh, I think and so so I'm just a big proponent. And so,
yep.
And so, you know, so
hey.
No, yeah, but that's the thing with doctors. You know, doctors have a whole different viewpoint on that type of, you know, healing approach. So.
Yeah, and I don't understand it because, you know, they keep saying there's not enough research, but there's so much research out there all over the world. And, you know, like, you know, I mean, a little bit, I'd like to mention just throw out a bunch of things that, you know, that I'm going to actually be covering soon. I'm just going to go ahead and make some IGTV videos. I'm going to do like a YouTube thing, but I'm just going to try to educate people about this because, you know, it's going to help them. You know, people need to get the word out, you know, that it's more than, you know, getting high, you know, it's healing us, and we need this, and, you know, let's get behind it.
Right. Renika, I think you have something on your mind.
I do. You know I do. My mind is twirling. So, Victoria, first of all, I want to say I empathize with you about the pain you're going through. You know, all these different tests you're going through. The doctor just impulsively decreasing your opiate pain management. That within itself can have significant withdrawal factors from it. Not a doctor, as you know, but still, I know a lot about the opioid and receptors and how that work in your body. Just understanding that there are a lot of medical professionals that does not identify marijuana as being a helping aid more so versus a hurting aid. So when you mentioned that your doctor called it poison, I always say this: you got to do what's best for yourself.
Right.
Like no one can tell you how you feel. You know, some may take the cannabis route, some may take the holistic route, some may just do nothing, but no one can tell you how you feel initially. And that's where I get a little upset when doctors try to give you these medications and want you to take something, but you can't tell me how I feel. I got medication in my drawer now. I have declined to take. Decline.
Right.
I'm not taking it. You can prescribe it. I'm not taking it. CJ had an incident recently, but he decided to take a medication prescribed to him because no one can tell you how you feel. That's your body.
Yeah.
But
That's right.
I think doctors at time, when they give you a medical treatment and don't follow, they can say, well, I tried all I can. I can remove you from being one of my patients. That's where the big conspiracy come at as well. So hopefully when you have these procedures done, they can find some understanding. Another thing that when you mentioned about the loop colostomy and the still having the I'm gonna say the output through your anal area, that's a part of that overall loop colostomy portion because you still have your anal area intact. So the lower part of your colon still is functioning appropriately. So that's very much so normal to do that. The pain part, not much so, but the other part, it can't happen that way.
Actually, that's not what he showed me in the diagram, but yeah.
My
So-
doctor told me that it was normal part for a person that has their whole colon still intact, the bottom part, like a water hose, he said.
Well, I had my whole large colon. I do have my rectum, but I had my whole large colon removed when I was 16.
Okay, well, that's different then. Okay.
Yeah, so I'm kind of like different, I guess.
Yeah, okay. Well, either way, I hope you find some relief from. I know it's not fun at all, and that's like Jordan said, Crohn's, our kidneys. We can get a fistula from our GI system to our kidneys, opening. I mean, you just can name it. It can happen.
Well, actually, kidney stones, I've had them twice. They're a side effect of Crohn's also. That's what I was told.
Mm-hmm.
I had surgery on them once because the stone was so huge, and I had, the other time I did pass them. But yeah.
Wow.
Do you feel like doctors try to pass on some symptoms as like Crohn's disease?
Do you think
Like,
they say that again?
that sometimes like when you have like a random symptom, a doctor tries to pass it off as like Crohn's disease? You know what I'm talking about, Renika?
Mm-hmm, I do.
Go ahead and comment then. I want to think about that for a minute.
Okay, so CJ and I had a discussion before. Like before we had Crohn's, we had other things going on. Like, my knee hurt. Oh, you may have a sprained ankle, whatever. Now, oh, my chest hurt. You know, Crohn's does that. My throat sore. Oh, just Crohn's. My stomach hurt. Oh, everything is Crohn's because you have Crohn's. They don't feel at times. It's easy to say, oh, Crohn's is causing this because they don't want to investigate the actual problem because they don't know the actual problem. So it's easy to say, oh, that's a side effect of Crohn's. Oh, that's Crohn's. I have dry skin. Oh, your Crohn's causes dry skin. I can't just have eczema.
Right, I get it now. Yeah, yeah. I haven't had problems with that. Nobody's really said to me like, it's been real. They didn't even think these bladder infections, except for the fistula before, that was probably, it was a rectal vaginal fistula, so that could have been causing them then, but I don't know now because I kept having them, So we weren't attributing them to, people just kept, doctors just, because I have different doctors, right? And through this whole process, and they just kept giving me antibiotics, and not just, okay, well, it'll clear up. Well, it doesn't clear up. Every time then I keep going back, as soon as the script's done, I'm sick again.
Right.
But doesn't antibiotics like make our IBD like worse?
No, probably. I don't think. Yeah, I've heard that too.
I know in females, due to our body different than males, it can cause a lot of vaginal challenges with a lot of antibiotics. You have to take that medication with another medication to help alleviate the other symptoms that you was originally diagnosed for. So I know in females, it may cause a more problem than actual males, depending upon what antibiotic you're actually on. It's what my experience has been. Something to think about.
Yeah.
Yeah, I it's funny, but yeah, just listen to you and CJ, Renika, it's funny. It's kind of a funny thought, but no, I don't think that. I'm kind of thinking to myself now, like, yeah, it's everything Crohn's related, but But for me personally, it's I think my doctors haven't said that kind of stuff to me, and so but I do, but now I think about it, like maybe I should stop, or kind of really parse out, what's Crohn's and what's not. It's kind of funny, so Victoria, so given that things have been challenging lately, so what, given this is a new year and stuff, and so what's your kind of outlook for the year, and what's your kind of and do you have any kind of approach to to maintain positivity?
Oh, absolutely. I have a lot of ideas for this year, especially with regards to advocacy. Can we go back to the cannabis thing for a minute, though?
Yeah, definitely.
I'm not making this decision lightly to only treat my Crohn's with cannabis. That's my choice also, right? I'm not taking any biologics. I'm not going to take Stelara. They wanted me to. They've probably asked me again. I stopped a long time ago. None of that stuff ever worked for me. I did make a list of the drugs, because you asked me about it before, of what I have taken. Zolpidem, I think it is, methotrexate, Remicade, prednisone. Those are the main ones that I tried. They just had adverse effects for me. They didn't really, they didn't work. And when I found cannabis when I was like 28, then I started seeing some relief. But anyway, so listen to this. This is just from one study. There's several gastrointestinal effects of cannabis that include the relaxation of the esophageal sphincter, a reduction in visceral pain, and a decrease in the gastric motility and secretions. These effects can positively affect patients dealing with IBD on a regular basis. It's also been, another study says cannabinoids appear to have a clear role in gut pathology and offer a potential target. Case reports from 1990 describe patients with IBD maintaining remission of the disease, successful management of abdominal pain, joint pain, cramping, diarrhea, poor appetite, weight loss, and nausea. Physicians are often unaware of the therapeutic roles that cannabis plays.
And that's, in Victoria, you're right. You're absolutely right. That's why I think there's, so many states. People are starting to, it is happening. This kind of ignorance toward. It's kind of an intentional ignorance, right? The reason there's so little science about, the benefits of, cannabis, and is because that was done on purpose. Because if you don't research it, then you don't know how helpful it is. So now there's been, people are, using, since it's legal in states and stuff, companies, private companies can do their own science and all that stuff. And so, it is cool. Things are expanding, it's getting better. And I think that ignorance, that medical ignorance attached to cannabis is starting to really lessen.
Today I went to a new dispensary. It's all women owned.
Cool.
Nice.
And try to see if T can get her CBD in there. That would be really awesome.
Oh, wow. Look at you networking.
Yeah. So anyway, and I also got a plug in for a Crohn's veteran and told him about the podcast tonight.
Nice. Thank you.
Right on. And and this young lady was telling me she's also a medical patient, the bud tender. And she was telling me, you know, how cannabis has helped her. And because I was asking her questions about CBD and how it works together and how I can do both. And, you know, is it going to take down the effects of the THC, which I need for the nausea? And, you know, she answered a bunch of my questions. And I was just like thrilled, you know, to finally find somebody that could let me know. I asked T about it. I've asked other people about it. Nobody's been able to kind of help me figure out how to do both. And so that's pretty cool. But yeah, and yeah, getting out there. Awesome. Yeah, being an advocate here. Yeah.
You the plug, Victoria. You are definitely the plug.
That's awesome. That's awesome. That's all awesome.
That is good. I guess my question, Victoria, is I'm sorry, go ahead.
Oh, I was good. I thought you might want to wrap it up, but go ahead.
No, probably in a second. You know, you mentioned about the medical marijuana for medicinal purposes. I think a lot of practitioners who practice in states where it's not legalized would love to share that option, but because of licensing purposes, they can't do that. But I guarantee you, behind closed doors, they would give you some of the best insight and input about their thoughts about legalizing marijuana and using for pain management. When I worked as a therapist at another agency, my supervisor, she was like, I don't know how you do this. She said, do you smoke marijuana? You trying to set me up? I'm trying to answer that question. She was serious. She said, Sonia, she said, it can help you. I'm looking like, wait a minute now. I'm working with clients that have substance use, mental health diagnosis, and you want me to, if I won't tell you I smoke some weed, I'm not doing that. But she was on cannabis for pain management. Like that was her talk all the time. I think she used cannabis for her pain management. She's trying to encourage me on the low, but I didn't bite the bait, you know what I'm saying? But you know, behind closed doors could be a different situation. But I do think practitioners, when they're able to have it legalized in states, then the conversation become more open and more receptive than those that states that's not. So good luck with that transition. I hope that whatever you decide to do be the best for you, and you have a good thought about what you're doing is for Victoria, not for nobody around you. You know, that's my biggest hope for you.
Right. Thank you.
Yes.
Thank you.
You're welcome.
Yeah. You know, like guaranteed doctors out there know, you know, they know about it. TED Talks has a lot of just really interesting. Yeah, really interesting. Yeah, about doctors that are just like blown away, you know, like major like brain surgeon or whatever, you know, like, you know, blown away because they, you know, found out this helps their patient, you know, and just, so, but yeah, it's yeah, I have tons of information and read so much studies, and you know, and so yeah. So I'm hopefully that's part of my New Year thing is getting those videos made. If you look at my first video that I put on IGTV of me, like, you know, October or November 2019, you know, when I was like saying I wanted to get the word out because that I knew something that would help. That's what I'm talking about is cannabis. And I had just taken a hit, and I hadn't had a hit for like, you know, over a month because I'd been in the hospital, and I was just like blown away by how much it made me feel better and how I wanted to eat. I was just like, wow, you know.
Definitely. You know, with cannabis being a natural depressant, it suppresses the central nervous system in a way, so it gives you that pleasurable sensation, and it can really, I don't want to say paralyze, but it can really cause a common effect through the whole body. Think about all the nerves that you are actually hitting when you smoke marijuana. Your body's feeling relaxed.
Yeah.
So that's why if I could talk about it more, do my profession, just don't know this. Do whatever is best for you. I can stand by that. No one can tell you how you feel.
Yeah.
I'm a firm believer in that.
Right. Yeah. And before you can really CBD, I'm seeing, you know, you guys have won me over, CJ, you know, because I like, you know, wow, you know, you talk about it, I'm like, man, they really are like relaxed. And, you know, like the CBD really is helping them, you know, like, you know, so I'm going to go for it. But yeah. So anyway, but as far as the future goes, I'm like, so I have what I call goal posts.
Okay.
And they're my posts that I want to do, right?
Yeah.
Right.
And you guys were talking about posts and how stressful they were for you, like CJ. I like that one about mental health and just like, most of the time they're kind of like take me all day,
Yes. Yes.
And I'm like, how do you guys do it? You make it look so easy,
It's not.
So
It's not easy.
one reason why, yeah, right. Yeah, it's not easy. And thank you for like effortless and beautiful. It's amazing. 14 countries, man. Wow.
I know. We, and so that's what, speaking of goals, that's, it would make me so happy, to have, even more people around the world to talk to, to hear more stories, more perspectives. I'm just, just fascinated just to talk to people from just other cultures and other walks of life that have Crohn's disease. It's kind of this commonality between us all type,
Yeah.
But yeah, so anybody listening, thanks for joining us today. Also, reach out to Victoria. She's a walking guru of information and advocacy. So check her out on Instagram. Check us out. If you like our show, please subscribe, like us, share our content. Check us out on Crohn'sVeteran.com. Check out our Teespring store. We got great merch on there. And we appreciate you guys' support. CJ and Renika, thanks for joining me too. So, all right. Well, and thanks for joining us, everybody.
Thank you, guys.
Thank you. Yes.
Stay motivated, stay encouraged.
Yeah.